I know many of you would have had to take some or the other antibiotic at some point in your life, right? And I also know that many of you would have self-medicated on antibiotics without consulting a doctor. But did you know that as per the Central Drug Standard Control Organization, antibiotics belong to Schedule H and H1, which means that they cannot be dispensed without a valid prescription. So you must be wondering, why am I discussing this with you? I mean, it's the pharmacist's problem if they're dispensing without a prescription, right? The problem is that such unchecked, improper use and misuse of antibiotics leads to something called as antibiotic resistance, which causes deaths of millions of people around the world and is a major public health concern. Now, before we discuss all this, let's understand first what actually is an antibiotic. Now, we all know that there are various pathogens that can cause illnesses in our body, like bacteria, virus, fungi, and parasites. Now, antibiotics are drugs which are specifically designed to act against only bacteria. They either help us by killing these bacteria or preventing their multiplication. From using sulfur drugs and penicillins, we have come a long way in the last 100 years in our antibiotic journey. And so also have bacteria. Now, if we follow Charles Darwin's theory of survival of the fittest, it's easy for us to understand that over a time period, these bacteria also evolved to escape the effects of antibiotics by developing various defense mechanisms. So some of them may acquire some changes in their genetic material, some of them make changes in the structure of their cell wall, some of them create certain receptors or enzymes which help to neutralize these antibiotics. Now, I'm sure all of you know that we have some bacteria that live inside us normally, right? The so-called good bacteria. So these bacteria or the commensals, apart from helping us carry out a lot of physiological functions, one of the most important roles it plays is to help us fight against outside pathogens and outside bacteria. Now, each time you take an antibiotic, the drug cannot distinguish between good bacteria and bad bacteria. So these antibiotics not only kill the bad bacteria but also end up killing some of the good bacteria. Now consider a situation where you do not take the complete dose of a medication. Now it ends up killing some good bacteria and some bad bacteria, which is why you feel symptomatically better. But if you do not take the complete dose, it does not effectively eliminate all of the bacteria, which means that some of the remaining bacteria can develop resistance to that particular drug. And every time you sneeze, you cough, you yawn, or there is exchange of bodily fluids in any other way, you end up transferring these resistant bacteria to other people. The consequence of all of this is that when you fall sick the next time, it may be more severe, the duration may be longer, you may require hospital stay, and you may require higher antibiotics and sometimes intravenous antibiotics. You may also end up needing additional medical procedures to help you through this illness. And the worst part is when these resistant bacteria affect people with slightly lower immunity, like children and young infants, elderly people, chronically ill people and immunosuppressed people, it can lead to drastic complications in these people. Please do not self-medicate with antibiotics. Please go to your nearest doctor. Let them evaluate you and determine if you actually have a bacterial infection and you actually need an antibiotic. Do not pressure your healthcare provider into giving you an antibiotic if they think that you do not need one. The most common simple illnesses like a common cold are viral in nature, which do not require any antibiotic. These are self-limiting and they only require symptomatic treatment and some patience. It will get better in 5 to 6 days. The biggest thing that you guys can do is take care of your body. Prevent from getting such illnesses by maintaining good hygiene, good nutrition, cleanliness at your home and your surroundings, having healthy food practices and a healthy lifestyle. All this will improve your general immunity and make you less susceptible to these infections in the first place. Make sure that your patient actually has a bacterial infection and they require antibiotic for it. Wherever possible, try to get a culture and sensitivity report to determine which antibiotic would be most effective for that particular condition. Make sure that you calculate the right dose for your patient depending on their body weight, and this is especially important in children. Make sure that you give the medication for the right amount of time. Explain to the patient the importance of taking the medication for the entire course. Make sure that you explain to the patient what are the possible side effects and what an allergic reaction to that particular medication looks like, and to revert back to you in case of any of this. There is an excellent book called as the WHO Aware Antimicrobial Book, the link to which will be in the description below. It is there in the WHO's official website. It's a very helpful and a very concise book covering a lot of the common illnesses that we see on a day-to-day basis. It's going to be really helpful in your daily practice. I would urge all of you to go through it.